Start. Hey, boy. Good. Why are you so far away? Just gonna give you a hug and a kiss. Good afternoon. I just want to thank everyone for joining us today. We're here today at Hoboken University Medical Centers, our critical care, urgent care facility for the city of Hoboken, run by CarePoint Health, and our acute care facility, not just for Hoboken, but for the entire region. I first want to thank Governor Murphy, whose leadership has made New Jersey among the most aggressively combating the spread of the coronavirus. I also want to express my gratitude to our congressional delegation, especially Senators Menendez and Senator Booker, as well as Congressman Albio Ceres, for crafting bipartisan relief that will help all Americans. So, why are we here today? I'm here because our hospital, the Hoboken University Medical Center, has sounded the alarm. They've literally rang the alarm. I won't mince words. Hospital leadership has informed me that in 6 days, they will completely run out of critical, life-saving medical supplies and equipment. In 6 days, we will not have the resources we need to save lives. In 6 days, the hospital's personal protective equipment, including N95 masks, gowns, gloves, and more, will be used and gone. We're near capacity of ventilators for critical patients, and for everyone else, we'll need to rely on emergency backup ventilators, which are not as useful in terms of efficiency as the ventilators we're using now. As this coronavirus continues, our healthcare professionals are working tirelessly, day and night, to literally save people's lives. These are some of the most trying times our doctors, nurses, and staff have ever seen, and they're living it every day on our front lines. More and more patients are coming to CarePoint to get tested and treated because COVID-19 and medical professionals predict it's only going to get worse, with the surge projected in just a few short weeks away. The hospital has already developed plans to expand the emergency department into space in the parking garage adjacent to the hospital to manage the influx of patients coming in. But added space will not matter. It's literally meaningless unless you have the supplies in there to come quickly to treat the patients. As I've stated, I'm tremendously grateful of the national and state leaders for making resources available to this fight and the spread of COVID-19, including the stimulus bill, which will soon unlock resources and funding. Now, however, comes the comes the time to decide where exactly do those resources go, and to do so as quickly as possible. Delay is not an option, ladies and gentlemen. Delay is not an option. Lives are literally on the line. They're on the line. This is my message to the Federal Department of Health and Human Services in making decisions. Hoboken desperately needs your help, and we need it now. That is my plea to the federal government and the Department of Health and Human Services. We need your help in Hoboken, and we need it now. Without your help, if we do not get this urgent help now, in 6 days, doctors could be faced with clinical decisions impacting lives. We can't afford to have our doctors and nurses reusing masks and other equipment several times a day because they have no other option. Cities like Hoboken and other Hudson County municipalities are literally hitting a breaking point. We're hitting a breaking point right now, and we need to do everything possible to ensure doctors aren't forced to pick and choose who lives simply based upon equipment shortages. As the logistics and the funding allocated in the stimulus package are finalized, I strongly and respectfully urge our president and the administration to recognize that the epicenter of COVID-19 in America, in this country right now, is in New York and in New Jersey. Over 28,000 cases are in New York City and New Jersey alone. 28,000 cases in New York City and New Jersey alone. In Hoboken, we just had 11 cases confirmed yesterday, and we just had another 16 cases confirmed today so far. And I'm speaking at about 4 o'clock in the afternoon. That brings Hoboken's total to 56. And that represents our highest totals to date per day. We have also unfortunately learned that we have had our first Hoboken police officer who tested positive for COVID-19. Shockingly, New Jersey has more cases of COVID-19 than the entire state of California. The only way, ladies and gentlemen, that we can flatten the curve is to stay ahead of the curve. And that is what we will continue to do in Hoboken. But we can't do it alone. When we have flattened the curve, we will turn around to the next community and the next state and share the resources and the supplies because that is what we do. That is who we are as Americans. Because in this moment, as a community, as a state, as a country, we are all in this together. I once again want to reiterate my sincere and deep gratitude and thanks to Governor Phil Murphy. Governor Murphy is in constant communication with the White House, and he is on the front lines advocating with Washington for more funding and equipment on a daily basis. Thank you, Governor Murphy. He is providing leadership that is saving lives, and I literally cannot thank him enough. I also want to again recognize the work from Senator Bob Menendez and Senator Cory Booker, who helped shape the current stimulus bill to ensure New Jersey gets its fair shake. As mayors, we've been on the phone on a routine basis with the two senators. They've been providing us real-time information as the situation unfolds. Senator Booker and Senator Menendez have been an incredible resource, not just to me, but every mayor in the state of New Jersey in providing real-time information and information that we can disseminate to our constituencies and our cities in Hoboken. So thank you very much to Senator Booker and Senator Menendez for being so proactive in this effort. At this time, I'd like to now introduce our City Council President, Jennifer Giattino. Jen has been working with my administration every single day on behalf of Hoboken. I'd like to thank her for her services. Ladies and gentlemen, Council President Giattino.
So Hoboken, we are right across the river from the epicenter, and I think it's really important that we all remember in times like these is when we as a nation all come together. So before I thank anyone, which I'm not going to do until Hoboken gets the supplies that they need, and that can't be tomorrow, that can't be a week from now, it literally has to be today. We cannot see this hospital not have the supplies it needs in 6 days. I don't want Hoboken to get forgotten about, because we are not New York City. We are just as important as New York City. I know everyone is doing everything they can, but I am pleading with our state officials, with our federal officials, to make sure Hoboken gets what they need. We are literally across the river from the epicenter. It is so important, so please help us, and all the thank yous will be there after you do. Thank you.
Thank you, Council President. I greatly appreciate your support and your words. I'd like to now bring to the podium Ann Logan from the Hoboken University Medical Center.
Good afternoon. I'd like to take a moment and thank Mayor Bhalla for organizing this event and this call to action. I also want to recognize our local, our county, and our state leadership for supporting Hoboken and supporting this initiative. We are in unprecedented times. My name is Ann Logan. I am the Chief Hospital Executive. I am a proud nurse, and I am here to serve this hospital. I'm here to serve this community. And I will tell you that right now, we have never dealt with something of this nature. We've never dealt with a pandemic of this totality. This hospital is a 333-bed medical center, acute care. We are in the most densely populated county in New Jersey. And we also are within the region. We're across the river from the most impacted region in this country, which is New York City, right across the river. We do anticipate a surge. We do anticipate increased acuity. Right now, the CarePoint Health System, we have across our critical care units, we have at least, if not more than 30 patients who are under investigation for COVID. We have more or less 20 ventilators. And the reason I say more or less, because this situation is very fluid. It changes hourly. I had 4 ventilators yesterday morning. By the end of the day, we had 10 ventilators in our ICU. The patients are getting sicker. The ages vary, and we really need to manage for criticality. For general reference, the Hudson County, as of this morning, there are 416 confirmed cases in Hudson County. CarePoint Health, to date, we've done hundreds of tests for patients under investigation. We have several positives. I think right now, I don't want to give you the wrong number, I'll give you that later, but we have several positive patients across our hospital. The point I want to make at this point is that we have several cases. There's a prolonged turnaround time for this COVID testing. We have many cases unconfirmed of patients who are in our hospital. So our number of positives could still be growing rapidly. We believe that, again, I'm speaking of surge. So the surge didn't happen yet, and we are already strained. Our resources are already strained. We anticipate within 2 to 3 weeks to be at full surge capacity, which is when the mayor talked about our ability to move some patients over to an adjacent space. We're working on plans to expand our critical care capability. So we are strained today. So my point is to this initiative, to this call to action, is that there are resources available to the federal government. Our call to action is we need them today. We need them tomorrow. We cannot be without these critical resources. There's a lot of discussion about personal protective exposure equipment such as masks, face shields, gowns, and I'll talk about that in a moment. But we also are at risk to not have life-saving equipment. What I'm speaking about is ventilators. Our regular ventilators are almost at capacity. So we have regular ventilators across the system, and we may resort and have to resort to using what's called emergency backup ventilators. Right now, again, I said we have about 20 ventilators at this time across the critical care. That number could be 30 tonight. That number could need to be 35 tomorrow. The ventilators are critical to us. The Department of Health and the Commissioner and the Governor have been very supportive, and Christ Hospital, our sister hospital, received 5 ventilators yesterday from the Department of Health. We are very grateful for that, but that's clearly not enough. We need more resource allocation. We have issues with HEPA filters. We have issues with prolonged time for testing for COVID. We also don't always have enough kits, which are my next physician speaker, Dr. Enriquez, will speak of in a moment. I do want to commend the mayor. I want to commend Commissioner Persicelli, and I want to commend the governor. And I want to just tell you that having healthcare workers in the workplace, and I'm going to take off my glasses now. So having healthcare workers in the workplace, not having enough protective garb, masks, face shields, gowns, gloves, hand sanitizer, sandy wipes for equipment, that's unacceptable. Our healthcare workers are frontline. They are very, very high risk because they care for patients who have coronavirus. It is unacceptable for them not to have what they need to provide the care that they need to the patients and to protect themselves, protect their families, and certainly for us to protect our community. So I reiterate, we need help now from the federal government. We are in crisis. I want to take a moment to thank the healthcare workers, the CarePoint healthcare workers, the healthcare workers in the state and across this country, because this is very unprecedented times. And I don't believe many people, if any, have dealt with a crisis of this nature. We have to protect the caregivers. They take care of the patients. They keep this country healthy, and it's our obligation, it's our moral and our ethical obligation. Thank you. I'm going to ask Dr. Melissa Enriquez, our ED physician, who's a wonderful advocate for patients and is a frontline caregiver. I'm going to ask Dr. Enriquez to come up now.
Before we have Dr. Enriquez say a few words, I just want to also thank Sergeant William Montanez. Sergeant Montanez is the head of the Office of Emergency Management. They've been working collaboratively with the Hoboken University Medical Center to make sure that as much PPE comes in through through OEM on a daily basis. OEM through the sergeant is making those supplies available to the hospital. I thank the sergeant for his good work in that regard. Dr. Enriquez?
Hi, I'm one of the senior ER attending physicians here at Hoboken, and I want to share some thoughts with you about the reality of our day-to-day currently in the hospital. We have seen an uptick of patients coming in with respiratory symptoms because they are all concerned about COVID. I can reassure them that most of them will get better in about 2 weeks with some home management of Tylenol and fluids. This is true. But unfortunately, what I can't do right now is test everyone. At this time, we have to reserve our tests for the patients who require admission to the hospital. Though we are seeing many potential COVID patients, we receive tests in drips and drabs without any regularity. Meanwhile, large testing centers get thousands of tests a day and see people who could sit in the comfort of their car for 3 hours. In addition, the tests take 3 to 7 days to result. We have patients in our hospital in isolation for that long, not knowing whether or not they have COVID. We urgently need more tests and we need faster tests. Also, while we know that a lot of the patients we see have mild symptoms and for the most part get better, there is a fraction that will get worse. We are going to see them in about 1 to 2 weeks, and we are going to start having to give them oxygen supplementation. This may mean only some nasal oxygen, but severe cases need a ventilator. Getting to the point where we have to decide who gets a ventilator and who does not is unthinkable and unacceptable. We know it's coming, and we need to prepare and have more ventilators. Finally, I want to give a shout out to the hospital providers and staff who keep coming to work every single day. While the rest of the country gets to stay home and quarantine themselves from the virus, we are running to it. The ER staff is at the front line, facing all patients, many of whom will have COVID. We need personal protective equipment. We are facing a shortage. We are reusing personal protective equipment according to the guidelines of the CDC. But this is not optimal. We all went into medicine to care for everyone. But now we are risking our own health and even our family's health because we may take the virus home. We need more PPE so we can keep coming to the hospital to keep our community healthy. I realize that COVID is scary. If you have minor symptoms, you could still stay home. There are online symptom checkers put out by the CDC. Check your symptoms there first. I commend the governor and the mayor for starting mandatory quarantines early on. Please maintain this. We came to work for you. Please stay at home for us. Thank you for the opportunity to share my experience.
Thank you, Doctor. This concludes the remarks, and if anyone has any questions, be happy to take them now of any of the speakers. I'm going to let Ms. Logan answer that question.
You're asking if there's staff out on quarantine? Is that what I can't answer?
Do you have staff currently out in quarantine?
Yes.
So how many are in need of nurses?
I have 5 individuals, and I'm not going to go by category or name, but I do have 5 affected individuals. I have a couple who have been exposed who are also out self-monitoring at home, and we need nurses. We need nurses anyway. We need nurses and physicians in preparation for the surge. Okay. I have 5 healthcare related I have 5 healthcare workers out right now. I'm not going to say categories or names. We currently are we're using somewhere. We were using this morning. We had 20 in use. I haven't checked the numbers. We get numbers twice a day. That's system wide, but our allocation is that Christ was allocated 5 from the Department of Health, the Commissioner, the Governor yesterday. We're requesting 13 more. Hoboken is requesting 13 more. Because we want to plan for the increase in the surge, the volume, and as the patients start coming, they're going to be a lot sicker. A lot of these patients end up on ventilators. They get very, very sick. So we're requesting 13 more. 20 throughout the system as of this morning in use. Each hospital has a par level of ventilators, and then we request additional ventilators to prepare for the surge. We have emergency backup ventilators. They are life-sustaining. We will be able to put patients on those emergency ventilators, but we need the normal, regular hospital ventilators for inpatient. We really need the other modalities. I'm requesting 13. No, just for Hoboken. Yes.
Can you tell me how
I have 30, my vice president of nursing, I believe right now 30 patients are isolated, 30. We have 19, it's called negative pressure rooms. We have 19 throughout the entire hospital. However, these patients, in the absence of what's called a negative pressure room, are in private rooms. We have some in ICU. They're all over the hospital, but we put them in private rooms, and they're on isolation.
You mentioned that you were in the process of actually reusing some of this personal protective equipment. Can you tell me a little bit more about what is currently being reused? And you mentioned CDC guidelines. How quickly then can you refresh that and include the new materials?
According to CDC guidelines, if we are seeing areas, we are in areas where there are multiple patients that potentially have COVID, we can go from one room to another to see those patients with the same gown and personal protective equipment. So the personal protective equipment is typically 4 items. It's the gown, the gloves, the mask, and the mask and the face shield, the goggles. Okay. Yeah. So we do. Yeah. We need pretty much everything, but the biggest shortages that we have are in the N95 masks, the surgical masks, and the gowns.
You also mentioned there was a shortage of tests. You said drips and drabs. The hospital tends to get them. How frequently do you then get these test kits, and how many more would you request trying to address this surge?
These test kits come at a very unpredictable rate. We were, for example, last week we were told we were getting, one day we were going to get 175 tests, and then the next day the company told us that they didn't send them because they didn't have them. And so they were sending us 20, as much as they could possibly allocate for us, according to all their guidelines, because they had to go to the larger testing centers first.
How do you decide who gets tested?
We test those who are probably going to be admitted to the hospital for COVID. Mm-hmm.
CDC says very short amount of time. Let's say the president does sign federal funds for this. Would you say that would help in the next 6 days, or even if it doesn't, what would be plan B? That money doesn't come in for days.
That's the exact reason why we're here today, is because when you take the time crunch that we're under of 6 days, and you combine it with the stimulus package, for which we're very thankful for, there's a lack of clarity as to when that can trigger the flow of funds that would be necessary to purchase the protective the personal protective equipment, including the ventilators, and then get them over to the hospital. My strong suspicion is that it's going to take a lot more than 6 days, which is why we're making this urgent plea, whether it's N95 masks, gowns, and especially ventilators. And Dr. Logan just gave you a very specific ask. 13 ventilators is the ask. Can we find 13 ventilators in this country to avoid having to make life decisions, is the question that we're facing here. We need those ventilators to not force doctors to choose one patient over another and possibly lose lives. So this is literally a matter of life and death. There are a total of 3 hospitals in the CarePoint system. One is the Bayonne Medical Center. The other is Christ Hospital just up the hill. That's in Jersey City. And here, Hoboken University Medical Center in Hoboken.
Will Hoboken step in at all and either try to solicit these materials from private companies, or perhaps go out and try to purchase them in order to help aid the hospital in some way? If, for example, the federal government doesn't support.
Right now, my understanding from a medical standpoint, and correct me if I'm wrong, Dr. Logan, is that to purchase these ventilators, they're ready to purchase them. They don't need city government to come in to pay for them. If necessary, they need the ventilators. They have the ability to procure them, but they're not here. We are running on fumes, and we need this additional personal protective equipment in order to allow the people who need ventilators most to have access to them. Before we wrap up, I just wanted to put this in a little bit of context. You might be wondering why across the river do we have about 22,000 cases. We already have 56 in Hoboken, but in relation to 22,000 in Manhattan, it's a lot, 56, but it's a relatively small number compared to 22,000. So why the emergency in Hoboken? Here's why. On March 6th of this year, March 6th, about three weeks ago, New York City had 4 confirmed positive cases of coronavirus. On March 11th, which was 2 weeks ago, New York City had a total of 48 cases of coronavirus. Now, today, 2 weeks later, they have 20,000, while we have 56. So I want to put that in context in terms of what we're seeing in New York in terms of the spike, going from 4 3 weeks ago, 48 in 2 weeks, and spiking up to 20,000. We're already seeing a surge in Hoboken, and we are trying to do or enact proactive preventative measures to avoid a New York City case. We are trying to block the wave, so to speak, and flatten the curve. And in order to flatten the curve, we've got to get ahead of the curve. In order to get ahead of the curve, we need the equipment to save lives. So I just want to thank everyone for being here, and I want to especially thank, and I can't say this in any more sincere way, all of the nurses, the doctors, the healthcare professionals, the healthcare workers. They are working on the front lines. They are going to work, so you don't have to go outside in harm's way. So when city government tells you to stay home, to self-isolate, these workers are risking their own livelihood to keep us safe. And I can't express how grateful I am to not just the people behind me, but everyone in this building who is working to save lives and to contain this pandemic. So thank you very much, and we'll be in touch soon.
Mayor? Thanks for your time, Mayor. Stay right there.
Stewie, did you see my son drop? Did you see my son drop? Yeah, you train him.
Test one, test one, test one. Mayor, welcome. Mayor, you said you've been in conversation with the two senators, Senators Menendez and Senator Booker, that is, about what their sense is as far as once the stimulus package is finally signed off and resources and the necessary resources and equipment that New Jersey needs. Have you gotten a sense from them, like as how quickly that may happen? I know you said you got 6 days of when the gear here will. You have 6 days to get that equipment, but did you get a sense from them that they feel confident that that will arrive in time?
Senators Menendez and Senator Booker have been on the front lines on a daily basis fighting for New Jersey residents, and we're deeply appreciative of their efforts. They've been in regular contact with the mayors of the entire state to provide us with daily briefings. This stimulus package is going to be an important trigger where, thanks to the advocacy of Senator Menendez, Senator Booker, and other Senate Democrats, we've been able to prioritize employees and frontline workers ahead of larger companies to make sure that this stimulus package prioritizes those most in need. And with respect to personal protective equipment, that is being run through FEMA through a process where you apply for your needs, and then funds are sent from the federal government to the state, to the county, and then to the municipality.
Sounds like a long process.
Well, we're hoping it is not as long as it sounds, and we are calling for emergency relief by any means necessary, simply because we don't know the certainty of the timing. We don't know how long it's going to take for us to make that application for money to purchase ventilators. That could take several weeks. It could take a couple weeks, but we need it now. We need it now, and we need to use every means necessary to get those ventilators. And the reason we need it now is because it's a matter of life or death.
We saw Governor Cuomo across the river, the governor of New York, that is, saying he needed 30,000 ventilators when FEMA, I think, was only, the Office of Emergency Management was only sending 400. So, I guess that's kind of what you're saying. You have 6 days, but it seems like it may take longer than 6 days to get the hospital to get the equipment that it needs.
Well, the hospital in Hoboken has made a very direct ask with respect to ventilators. 13. They need 13. So our hope is that with respect to ventilators, those can come in short order within this 6-day period. And then we can also get the N95s, the gowns, and any other PPE that we need that the doctor said also are in urgent need. Anytime you conduct a test, you need a new set of PPEs. So we're running short on supplies with not just ventilators, but all PPEs, because you need to rotate those sets as and when you do tests.
Mayor, thanks for your time.
Thank you.
Thanks again, Mayor. All the best. I gotta give him his, let's do a quick test one, test one, test one, test one, test one, test one, testing one, testing one. Reporting from Hoboken today, where Hoboken Mayor Ravi Bhalla was joined by officials from CarePoint, saying that they only have 6 days worth of personal protective equipment, and the hospital is requesting for a total of 13 ventilators. It all depends on when the government will start distributing those resources once the stimulus package is passed. Mark Busevich reporting in Hoboken for Hudson County View, the eye of the community.